Joining us now, we've got Dr. Rod Mitchell, who is the ANZCA President. Thank you for joining us, Rod.
My pleasure. Thank you for coming all the way to KL, beautiful KL.
Yeah, it is beautiful, and it's been pretty much exactly 12 months since we last spoke.
Indeed, yes, it has indeed.
Yeah.
That conversation.
So how's that sort of first 12 months gone for you?
Look, I have to say much better than expected, and primarily because everyone's been so incredibly supportive. So if I can now just say thanks to all those people who've been supportive, because I'm not doing this alone, and I've had probably over 100 people who've actively, given me counsel advice. So it's been great.
And what a beautiful place to come after 12 months than Kuala Lumpur.
Yeah, look, I haven't really got outside yet, to be honest. I've been here for a few days now, but I'm looking forward to getting outside, and I hope you're right. I hope it's beautiful. I'm sure it is, but I just haven't had a chance to get outside.
So what are some of the highlights for you over the last 12 months? What are your main things that you've been looking at?
Yeah. So look, I think that the challenge of taking on a role like this is that we have an idea of what we want to do, but the challenge is to make sure we get those things done. And so when we spoke 12 months ago, the three areas I was hoping to progress were perioperative medicine, doctors' health and wellbeing, and equity of access to healthcare. And I'm happy to say that in a practical sense, I think we've made progress in each of those three areas. There are three big areas, so there's no silver bullet, magic bullet. So in terms of perioperative medicine, I think we're getting a clearer picture now that what this will look like is that greater recognition amongst all stakeholders that a good perioperative outcome involves much more than just a good operation. It involves, the right operation with adequate optimisation, with very clear understanding of patients' expectations should there be complications after the operation, good intraoperative care, and then care for an appropriate post-operative monitoring for targeted populations. So there's that level of it, just that greater awareness, and I think there's an evolving understanding now that what we're looking at is, we're all better at perioperative medicine, but we do have a select group of people who will become the perioperative specialists, maybe 5% of anaesthetists, and they'll be the people who are driving the research and the education. There will be a qualification. It will be a multi-disciplinary collaboration, which anaesthesia will coordinate and will lead, but will not own. But we'll take on the role of leadership and coordination for this multidisciplinary effort. So that's all moving in the right direction. In terms of doctors' health and wellbeing, that's another really complex area, and that involves training health and wellbeing, fellows' health and wellbeing, bullying, discrimination, sexual harassment. Involves cultural competency, so it involves a whole number of layers there. But we are making clear steps in terms of raising awareness. We now have telephone counselling service. We now have welfare officers in every training hospital. We now have a framework and identification of other resources that people can be using. So I think that's quietly progressing in the right direction. And in terms of equity, which is once again very complex, we talked last year about the fact that we have marginalised communities within our community here. So primarily Indigenous, recent migrants, lower socioeconomic groups, disabled groups, who don't have the same access to our expert healthcare. We need to make sure everyone has access. There's our rural communities and our remote communities. And then looking internationally, there are our regional neighbours where access to healthcare is appallingly inadequate. So we're working in each of those areas. We've now got getting close to formalising a greatly enhanced diploma of anaesthesia for our rural GP colleagues who are responsible for delivering care to rural communities and for supporting our rural specialists out there. We've freed up some extra funding to support projects overseas in New Guinea and the Pacific. We are making inroads into just quietly increasing our engagement with the Indigenous medical community. So we're just quietly, making some inroads there. And when I say quietly, I think we're doing it as noisily as can be expected. But we're clearly moving in the right direction. We clearly have a plan. So in that sense, I'm feeling quietly comfortable.
Yeah, you've had quite a busy 12 months, it sounds like.
It's been busy, but it's been great. And this role is an absolute privilege and a pleasure. And as I say, I've had an enormous amount of support. So it has been a good 12 months.
And in terms of looking forward, what are some of your priorities? Are you continuing in those areas?
Yeah, look, I think I'm pretty comfortable that they remain our priorities. We are doing more in terms of international collaborations, so that's developing. Workforce remains challenging in terms of the future of anaesthesia and how perioperative medicine involved in that. There's still ongoing discussions about anaesthesia and anaesthesiology, but I'm happy that we're sort of, the momentum is moving in the right direction for those key things which I identified at the beginning.
How are you finding the meeting here so far?
Okay, look, I haven't had an opportunity to really get involved with the meeting, to be honest, at this stage. Monday morning?
Yes.
Monday morning, yeah. Look, I'm really pleased that the number of people who have attended. Given that we're offshore, we have a very healthy attendance. I'm pleased with the international flavour, so we have a lot of speakers and delegates from overseas, which is great. This is our first co-badge meeting, so we've co-badged it with the College of Anaesthesiology of Malaysia, with the Royal College of Anaesthesia in the UK, and with the College of Anaesthesiologists in Ireland. So this is our first co-badge meeting, and that's been very good. I'm really pleased to see we have a large GP contingent here this time, and I'm also pleased that we have a space program coordinator. So it's the first time we've had a meeting where we've had sessions on space medicine. So that's futuristic and interesting and exciting. So that's all good.
Yeah, that's definitely one of the ones on my list to look for.
Yeah, no, absolutely, it's fantastic. Yeah.
Well, thank you so much for joining us, and enjoy the week, and hopefully you get to go outside.
Thanks, Dan. Thanks a lot. Got you. Okay, see ya.